Earlier this year, the Department of Health and Human Services announced plans to absorb a variety of agencies, including the Substance Abuse and Mental Health Administration, into the new Administration for a Healthy America. Since then, the White House has proposed a budget eliminating a program that teaches first responders how to administer life-saving drugs like Narcan that can help reverse an opioid overdose.
John Koch from the Opioid Treatment Center, Community Medical Services, is joining us now to talk a little bit more about all of this. John, thank you so much for being here.
Yeah, thank you guys for having me.
Yeah, we appreciate it. Okay, can you tell us a little bit about the benefit of having Narcan be so accessible in the first place?
Well, I'll use myself for example when it comes to the benefit of having Narcan so accessible. Well, first off, 80% of overdoses are by reversals are by another person that uses drugs. So if we have it readily available to individuals that are using drugs with other individuals, then they are able to then help each other.
Yeah.
But for myself, when it comes to the ability to get Narcan, I would not be alive today if it wasn't for the ability to get my hands on naloxone and the life-saving overdose reversal medications that are available, because I myself have overdosed 3 times. I myself have been revived by first responders on 3 different occasions. And now today I get to be a father, I get to be a husband, I get to be a homeowner due to, this medication that was just simply available to those first responders and to lay people at that time.
And that's why this program is so important to you and to so many people, to make sure that the first responders know how to administer Narcan.
Oh yes, definitely, because if they don't know how to administer it, it takes 4 minutes for you to die during an overdose. So if we have them address that and they know how and they feel comfortable doing it, then it saves another life, and that adds up quick, and it's people like me that get a chance.
And from the capacity that you're serving in now, have you noticed changes in access to Narcan?
So we will see changes happening. If things pass where like the CAR grants for the first responders are not able to continue and they cut those budgets for those, we will see the access to Narcan go down drastically. We have several grants that throughout the country through SAMHSA that they're trying to dismantle at this time that are available, such as SOR, the State Opioid Response Grant, the Tribal Opioid Response Grant. All these provide money and access to Narcan and to services like the company I work with, Community Medical Services, that provide walk-in availability to receive Narcan and also receive treatment.
Yeah, that's huge. How do organizations like yours help people who need help getting off of fentanyl or opioids?
Well, they really help them by, first of all, providing an open door that you don't have to wait in a waiting line, that you're not having to be on a waiting list, giving you that moment of hope. Second, it provides the 3 FDA-approved medications that help to with your brain as you're going through the process of getting into recovery. And then also we wrap around you big time with counseling, peer support, and other services. That's actually how I started at the company, is helping just another person right in front of me. And I say, if you can help change one life, that's why we do what we do.
Yeah.
Absolutely. And as you have perfectly described, resources are so important. Y'all actually have a resource fair that's coming up. Can you tell us a bit more about that?
Yeah, so we're really excited. If you're out there and you're looking to learn about opioid treatment or what's involved with it or where you can go and how you can get this, go on over to 7205 West Colfax today from 11 to 4, and we're having a resource fair where we have some of our system partners. We will be handing out Narcan and providing availability to that, and also talking to families and loved ones about different ways and forms of treatment for the individual. And we'll be doing intakes on demand, so if you need help, you can get help today right now.
You are an incredible spokesperson
Truly.
for the company. I mean, your story and everything and just how passionate you are about it really is incredible, and we appreciate you coming on this morning.
And thank you for being so vulnerable.
Yeah,
thank you guys so much. I think it's if we can use our stories to help change the lives of another person, that's, we went through that for a purpose, and I'd like to have a purpose to my life. So thank you guys for having me, and thank you for being willing to shed a light on what's happening.
Well, hopefully you are changing a lot of lives in this moment right now. Thank you for coming in. We appreciate it.